Hi guys, I forgive the lighting and everything. I already recorded this all once and then it like messed up uploading. I tried to record it with the slides in the video and then my computer just kept crashing, so we're just gonna do a good old-fashioned YouTube video and I'm gonna have you guys follow along on the slides. So the slides are gonna be posted in your Google Classroom. But first we're going to go over a couple of things and then I will have you guys pull up the slideshow. So go ahead and be turning your Chromebooks on and getting those ready to go while I'm explaining. You guys all should have a textbook assigned to you. I made that little textbook sheet in Google Classroom. Oh, sorry. So there's a textbook thing in Google Classroom where I think it's called textbook log, where it has your name and then what book is assigned to you. That number's in the front cover of this book on that black rolling cart. So go ahead and grab your textbooks, find which one is assigned to you. You can pause this video if you guys need time to do that, but it should be written in this cover right here. Oh, it's okay, it's okay. Sorry, she's sleepy. But she don't want to close her eyes. Can you say hi? Say hi. Okay. So hopefully you guys are all turning your Chromebooks on, you're getting your textbooks out, and then you can also grab a workbook if you want. And remember, the textbooks you cannot write in, but the workbook you can. I'm also going to kind of explain a little bit about how these textbooks work. So I call these different headings learning objectives. So we are starting on chapter 1. So when you have your book, go ahead and flip it open to chapter 1. And this green heading is always the title of the chapter. So chapter 1 is called The Nursing Assistant in Long-Term Care. And that is the chapter we're going to start with. These red headings are what I refer to as learning objectives. So I kind of use this all throughout the year. I'll say, okay, today we're going to do learning objective 1, 2, and 3. And so I want you to read 1, 2, and 3. And so you know exactly how far you're reading and when to stop. So this red heading is learning objective 1. If we flip the page, we'll see 2 and 3. Some of them are longer than others, so I always take that into account when I am assigning things. Also important to remember, if you have your workbook, you can flip it open to chapter 1. And you'll see it has the same learning objectives listed. So if you are working in learning objective 1 in your workbook, the answer to those questions should be in learning objective 1 of your textbook. So they directly correlate. So if you are working on learning objective 2, you shouldn't be looking for the answers all the way in learning objective 7 of the chapter, if that makes sense. If that doesn't make sense, then I can explain it better when I get back, but the sections go along together. I always want everyone to read the whole information before they start the workbook, because if you are just trying to skim the textbook to answer the workbook questions, you kind of miss out on a lot of information and you don't end up doing well on the test or on the certification exam at the end of the year. So yeah, that's kind of that in a nutshell. Hopefully all that makes sense. I am going to post the slides that I made for this in Google Classroom. So the video today is going to go over learning objective 1, 2, and 3 is what I'm going to be explaining right now. These slides are not going to be completely finished because I just don't have them done yet. So I'm going to continue to work on them at home, but what we're going to go over today is completed. And you can just pull this slideshow back up when I post the next video for tomorrow. So go ahead and go to Google Classroom and go to classwork and then go to the slides section And then I'm going to title this slide Chapter 1, the Nursing Assistant in Long-Term Care. So go ahead and open that up. It should look something like this. And that way you can follow along with what I'm lecturing on right now. Hopefully you guys have already read Learning Objective 1, 2, and 3. If not, I can kind of go over some stuff and then you can read it and then work on your workbook sections. Chapter 1 and 2 is pretty much what we need to cover before we can start going to clinicals, because it has all of our, just safety laws, things like that in it that the state says we have to cover before we can go and take care of people. So we are going to start chugging along and getting that done. Okay. So, sorry, I'm going to be kind of looking at my information as I'm talking here. Our first learning objective in the red heading is compare long-term care to other healthcare settings. So CNAs work in all kinds of different areas of the hospital, of the nursing home, but this is referring to different healthcare settings, like different places CNAs work, like I said, the hospital, Houston House, home health, assisted living. We're going to kind of talk about what's the differences in all of those places, because you never know where you may end up working, whether it's as a CNA or a different kind of healthcare professional. Long-term care is very specific that it provides 24-hour care. I'm going to talk a little bit about what skilled care is. That's the next vocab word here. Skilled care is medically necessary care that's given by a skilled nurse or a therapist, and it's available 24 hours a day. So if someone's needing IV fluids and they are dehydrated and they need them for, overnight or whatever, that would be a type of skilled care. Or providing tube feedings, or ventilation if somebody's on a ventilator. Those are all skilled, special tasks that nurses have to do. So that wouldn't be like if you're going to the doctor's office and getting a shot. Okay, so it's kind of your higher level health care. So long-term care facilities take care of people with these chronic conditions. We're going to talk about the word chronic in a minute. And we give them 24-hour care. So if it is not care provided 24 hours a day, it's not considered a long-term care facility. The only long-term care facility we have in Houston is Houston House. Length of stay is pretty much exactly how it sounds. It's just how long a person is staying in a healthcare setting. Okay. And that's usually like how many days, how many hours, that kind of thing. Our next vocab word is terminal illness. So that's an illness that will eventually cause death. That doesn't mean that person's going to go right away, but that we can't cure it, we can't make it better. Okay? The next vocab word is the word chronic. So this is a condition that lasts for a long period of time or forever. So they're not going to just, get treatment and then get better and be done with it. It's going to last for a long time. The opposite of chronic is the next word, acute. So acute is a short-term condition. So if you have a urinary tract infection and you go to the doctor and you get antibiotics and then you're better, that's a great example of an acute condition. Or strep throat, influenza, all of those are short term. We get better and we move on. Okay, I'm going to the next slide here, talking about diagnosis. So hopefully you guys all know what a diagnosis is, but maybe some of you don't, and that's okay. But that's just a medical condition that's determined by a doctor. Very important to remember that only a medical doctor can diagnose a patient. So nurses can't diagnose a patient. Even though a lot of times we think we know what's wrong with somebody, only a doctor can provide an actual diagnosis. Okay? That is a test question, just so you know. Okay, moving on to the next slide. I'm looking at home health care. This is care that takes place in a person's home, so kind of self-explanatory. Home health only cares for people who cannot leave their home. So if you have somebody who is able to get out and go to doctor's appointments, come in, do physical therapy, they don't qualify for home health. Assisted living is kind of like the level before someone goes to the nursing home, if that occurs for some people. So it would be, they're not getting care 24 hours a day, but they are having people come in and help them with their meals, their baths, some medications, but they're left alone for other parts of the day. So they don't have help 24/7, but they do get help with those certain things, okay? Adult day services is our next care facility setting. And a lot of times this is for people with mental disorders that kind of need watched over during the day. This can give their family members, who are usually their caretakers, time to go to work or just a break. Yeah, we do have services for this in Houston. I can't remember the name, but a lot of times one person, like a CNA or someone with training, will stay with like 4 adults during the day and just kind of watch over and make sure they're safe and those things. A lot of times those adults can go to the bathroom and kind of take care of their needs like that, but they kind of need someone to watch over them and make sure they're being safe, okay? Acute care, we kind of talked about that, but there's acute care facilities where you're going to come in, get your treatment, get skilled care, and then go home. So this is for short-term immediate illnesses and injuries, okay? The emergency room would be a good example of a type of acute care. Subacute care, I don't go over a whole lot because that's just not a term we honestly use. I did put it on the slideshow because your book talks about it, but there is not a test question on this, and it's just not something we ever talk about, okay? But it's kind of in between acute care and chronic care. So yeah, okay. Outpatient care is very unique. So it's where you're going to get a procedure and then you're going to go home. So it does not require an overnight stay. So if anyone has to stay overnight, it's not considered outpatient care. You can go to the hospital for outpatient care. So if I had an iron deficiency, okay, or if I needed a blood transfusion, I could go check in at the hospital as an outpatient, get my blood transfusion or my iron infusion or whatever I needed, and then they could discharge me and send me home. Okay, that would be an example of outpatient care. We even do outpatient surgeries. So a lot of surgeries, you can go in the morning, have them done, and as long as you meet all the requirements to go home, like you're eating, drinking, walking, and all the and go and pee, they'll discharge you, send you home, and that would be an outpatient visit, okay? Sometimes we have people come in for an outpatient procedure and things just don't really go as planned, or they have a rougher recovery and they have to stay overnight. Then they're not considered an outpatient anymore, okay? Rehabilitation is care given by specialists or professionals. This is usually like someone comes in and they've had an accident to where they're needing several kinds of therapy, and we're trying to get them back to their best level of functioning. So let's say someone was in a car accident and they broke their leg. We could admit them into a rehab facility. We could give them physical therapy, occupational therapy. This type of patient wouldn't need speech therapy, but some different conditions do. And it's all about kind of getting them back to their best level of functioning after some kind of accident or illness or injury. Hospice care is very specific because, well, let me tell you what it is first. So hospice care is given in facilities or at someone's home. They can do either one. And this is for people who have terminal illnesses and they have 6 months or less to live. That number is just a number. So some people can live longer than that. Some people live a lot shorter than that. It's just whatever their bodies decide to do and whatever plan, is in store for them. But it's very important to remember for hospice care, the focus is not on them getting better, because they're kind of past that point. The focus is on keeping them comfortable and providing emotional support to them and their family. Okay? So if we have someone on hospice and they get an infection, we're not giving them antibiotics, because that would just be prolonging their condition. We would just be focusing on keeping them comfortable and clean and all of those things. Okay? Now we're on learning objective 2. So that next red heading in the book is describe a typical long-term care facility. And if you're following me along in the slides, you should see that heading is now number 2. A typical long-term care facility offers personal care for residents, including bathing, nail care, skin care, mouth care, assistance with walking, eating and drinking, getting dressed, going from one place to another, and elimination. So elimination is just the medical term for how somebody goes pee or poop, okay? So if somebody has a catheter, that's like a tube that goes in their pee hole, that would be how they eliminate urine. If somebody has to wear a diaper because they can't hold in their poop, that would be how they eliminate stool. So just depending on your patient is however you're going to take care of those needs, okay? So it's very person by person differences. All of these different things that we do on a day-to-day basis that we take care of without even thinking about it is what we are, as CNAs, helping these people do in care facilities. All of these things are known as activities of daily living, or ADLs. So this whole list of bullet points are examples of ADLs, okay? Activities of daily living is a really important vocab word. We are going to be using that word all year long, okay? So just kind of really stick that one in your head and just think that's our whole job, is to help people take care of their activities of daily living, okay? Okay, and then I do want to say the blue boxes in your textbook, please make sure you're not skipping over the information that's in those. They have really important information. I think sometimes people kind of ignore those boxes in textbooks because they're like, meh. These blue boxes have really important information, and a lot of test questions come from the blue boxes throughout the year. So I always tell everybody, please don't skip over those, because you'd be missing out on great stuff, okay? All right, in the blue box, it talks about person-centered care and trauma-informed care. So person-centered care is a theme throughout the whole book and everything we do. It's basically focusing on your patient as a person, not just taking care of them like you take care of all your patients, okay? So it's giving them choices and treating them like an individual. So if I go in my patient's room, let's say, I'm going to pick on Leah. Let's say Leah Wallace is in the nursing home, and she has a closet of clothes because they do have a small closet, each of them do. And I just grab a shirt and a pair of pants and some socks and say, okay, Leah, it's time to get dressed. Let's get your clothes on. I should go in there and I should give her choices of what she would like to wear that day, because maybe she didn't want to wear that shirt. Maybe she didn't want to wear those pants. Maybe I grabbed jeans and she wants to wear sweatpants. I don't know. So instead of doing that, I should go in and I should say, hey, Leah, what shirt would you like to wear today? And she can look at her closet and she can let me know. Or I could even help her up and she can look in her own closet. Okay, so it's treating everyone like a person and giving them as many choices as possible, and not just kind of rushing through and taking care of everybody the same way. Okay. Trauma-informed care is exactly what it sounds like. We just need to be aware that some people have trauma, and making sure that we're sensitive to that when we're taking care of them. The most common one that I've experienced is that some people have had histories of sexual abuse, and maybe they don't want a female caretaker, or maybe they don't want a male taking care of them or helping them to the bathroom. So we just need to be aware of those things as much as we can be, and respect, any boundaries that they have, and be aware of that. Oh, another one I have came across before. There's all kinds of trauma, but people who have PTSD, or they've been overseas or at war somewhere, sometimes they'll tell you, if you need to wake them up, to tap their foot or to say something, because they can get startled and get violent, and could accidentally hit you if you were to kind of get real close to them to wake them up. So just being aware of all those things keeps you safe and your patients comfortable. Okay. We are on learning objective 3 now. Explain Medicare and Medicaid. So kind of boring, but we do need to know the difference between Medicare and Medicaid, because they are 2 different ways that people get their health care paid for, and they can get their health care services available to them. So Medicare, it covers people who are 65 and older, or if someone has permanent kidney failure or certain disabilities. So you could have a 25-year-old with permanent kidney failure and they would qualify for Medicare, but it's typically for people who are elderly, okay? It does have 4 parts, A, B, C, and D. I don't really think it's that important to memorize what's part A, what's part B, what part C and D. I don't think there's a test question on it. If there is, I'll just tell you the answer to it, because at the end of the day, it's just not that important to memorize it. What is important about Medicare is that it's for people 65 and older, or if they have kidney failure, and it will only pay for care that it determines is medically necessary. So this can get tricky, because sometimes the doctor says, let's say Mary is 70 years old and he wants to do a biopsy on her skin, okay, for some reason. Let's say she has a suspicious mole, okay? And so he puts in a request to her insurance, which is Medicare, and for her to have this procedure done, and Medicare can come back and say, well, we don't really think Mary needs that, so we're not going to pay for it. And then Mary is left with the choice, okay, is she going to pay out of pocket for this procedure, or is she just not going to have it done since Medicare won't cover it? Sometimes the doctor or the healthcare facility can go in and provide more information and maybe get it approved. But, that is the tricky part of Medicare and Medicaid, is that they really only pay for things that they think they should pay for, okay? Okay, so that's Medicare. I think I kind of keep that one straight in my head by saying, okay, Medicare, I'm going to care for elderly people. Okay, that's kind of how I keep these 2 straight in my head. If you have a better way, then I just find dumb ways to remember things. Okay, Medicaid, it is for people who are low income or have certain disabilities. Okay, so they look at, how many people live in your household, how much money you bring in your household, and usually if you are below the poverty line for your area, then they will cover you under Medicaid. the federal government did just make some really big cuts on Medicaid funding, and they are taking a lot of people that usually are on Medicaid off of Medicaid. So we are going to probably start seeing a big population of people who have no health insurance. So that's just kind of a change that's coming up that we will see how that impacts everything. So Medicare is for elderly, Medicaid is for low income. And then there's a slide where it just kind of compares and contrasts those and puts it in kind of a graphic for you. And that is all we're going to do today. My slides do go on for learning objectives 4 and 5, but I am still working on those slides. So today we are just focusing on learning objectives 1, 2, and 3. So you're reading those sections in your textbook completely. You're hearing me explain it to you on these slides, and then you're going to answer questions about those in your workbook. This is kind of how I flow with it throughout the year. So that way you read it, you hear it, you see it, and you're applying it by answering questions. So the goal is that kind of meets all those learning criteria in your brain and really soaks in all the information. So that way at the end of the year, you are gung-ho and you know everything, and you can answer any CNA question that certification test throws at you. If you guys have extra time today and you're not done with OSHA 10, just kind of truck away at that whenever you have downtime. And yeah, I will hopefully see you guys soon, and let me know if you have any questions. Thank you. Bye.